Good morning. My name's Chris Pont. I'm CEO here at EG, and today we've got a really interesting guest, James Duez, who is he's an investor, co-founder, and CEO at Rainbird Technologies. Welcome, James.
Hi, how you doing?
Hey, good, thanks. How are you?
Yeah, very good, very good.
Good, good. How's things? You're up in Norwich, aren't you?
Yes, I'm in Norwich. We have people distributed all over the place. I mean, in peacetime, we would be in an office in Norwich plus another one in East London, but everyone's working from home, as is the case for many right now. But
Yeah, yeah.
yep, it's a beautiful sunny day, and we can't complain.
Yeah, yeah. Lockdown's starting to lift. There's some positivity. There's some great weather. So yeah, fantastic. I like how you described that as during peacetime.
Feels a bit like that, doesn't it?
Yes, yeah, definitely, definitely. So, James, I've got some questions for you, all about Rainbird Technologies. I've been aware of Rainbird for probably about 7 or 8 years now. And could you give us a quick overview of who Rainbird are, what you do, and particularly where the name came from? Because I know there's an interesting story there.
Yes, there is. Well, so yeah, you've probably known about us since pretty much the beginning because the business was founded in 2013. So Rainbird is an intelligent automation technology. So our technology is all about automating the kind of complex decision making which is traditionally reserved for human beings. We take ordinarily expertise which is locked up in people's heads, sort of formal models of logic, and enable you to build that into our technology really as without having to be a software engineer. And what you're building is what we call a knowledge map. We're not a tool for building decision trees, but much more holistic, reusable models of knowledge. And these can be connected to data, and they can effectively synthesize a process of human reasoning and make decisions at scale. And so we're an ecosystem that enables our partners and our clients to automate, typically on any process diagram, somewhere you have people doing sort of people work. It enables them to build tools that really augment those people, typically, enabling them to do a job with ridiculous efficiency, making much better quality decisions. And that's important. It's not just about an efficiency play. It's about being able to create decisions that are higher quality than you'd be able to make with humans or even technology alone, but working together. But also powering a whole new range of digital sort of products and services. So people taking expertise and embedding that in software so that people can speak to the bot effectively rather than necessarily speak to the human, and free the human up to do the kinds of things that technology is very poor at, like listening or building rapport with customers. So that's the basic principle. And when you look at the landscape of AI and intelligent automation, and particularly if you look at the process of how decisions are made, typically, machine learning and data science is very good at making predictions. But what that's not very good at is applying judgment. We typically rely on human beings on the end of that process to apply judgment. And you might say that prediction plus judgment equals a decision, ultimately. And if we're going to allow technology to be involved in automated decision making, we need to understand the rationale behind that decision. And that's been one of the big problems with this space over the years, is actually, machine learning is not readily explainable. So if we can bring a level of transparency and auditability to how those decisions are made, then that's all to the good, particularly when we're making decisions of high impact. And so Rainbird as a business then is about enabling you to take data and the corpus of human expertise and build superior decisions at scale that are auditable. And then as for the name, it is a bit of a funny story. The short version is it's a bit of a nod to Bertrand Russell. He wrote Principia Mathematica way back along with Alfred Whitehead, which was the first time anybody had created a formal method of mathematics. So you could actually say that if it wasn't for Bertrand Russell, Alan Turing wouldn't have been able to do what he did in the war with the Colossus machine, and the whole field of AI wouldn't really exist. So it's a nod to him via an old children's TV program called Bagpuss. If anybody old enough to remember Bagpuss, there was this very dusty wooden woodpecker on the shelf called Professor Yaffle. And that is a very dry character with little sort of spectacles. And that character was modeled on Bertrand Russell because he looks a little bit like that. And yaffle is an Old English word for a woodpecker. And as it happens, Rainbird is also an Old English word for a woodpecker. So it's a nod to the philosopher and mathematician Bertrand Russell.
I love it, love it. So I understand you've been working with the NHS recently on a COVID risk assessment tool. Could you give us a little background on how that project came about and what it involved?
Yeah, no, absolutely. So when it became very clear in March 2020 quite how impactful COVID was going to be, we decided that, rather than panic and start furloughing staff, that we would actually lean in and see whether we could support, the UK businesses with our technology by applying it for free to try and solve specifically COVID-related challenges. So actually, we were approached by a number of organisations. We work with some of the banks around making decisions around financial forbearance, so helping people, manage getting mortgage holidays, for example, these sorts of things. But we were also approached by a number of trusts at the NHS, and they were having a whole range of challenges trying to scale certain sort of decision-making processes. So one of the first ones actually was just simply, clinicians were ringing in, not sure whether to isolate or not. If you think back to the beginning of the pandemic, we had this 7-day rule, 14-day rule. But if you've still got a fever after 7 days, you need to extend the time, and it was just complex enough to be confusing. And there was one hospital actually was receiving hundreds of calls a day just from staff who weren't sure what to do. And we suddenly thought, well, if clinicians are having problems with this decision, then there's probably no hope for the rest of us. So we very quickly, in just a couple of days, built a tool that enabled anybody to talk to a Rainbird powered tool to get contextual advice based on their circumstances. So, who's in your household, etc. And it would tell them exactly what to do, when to come back and check the tool again. It would automatically email their manager and say that they're not going to be in. And then as time went on, it would also book testing for them. And then we were approached again, and they said, well, that's fantastic. You built that in like 72 hours. One of the biggest challenges we now have within the NHS is we have over 1 million frontline workers who need to be risk assessed. And actually, NHS England mandated that everybody who is high risk should have a risk assessment. And we considered that was something of a catch-22. How do you know somebody's high risk unless you risk assess them? And ultimately, at the time, the government was saying, well, if you're from a BAME group, an ethnic group, or you're over a certain age, or your BMI is very high, or you're actually in the end, if you're even if you're just male, because men were at higher risk, then you need to be risk assessed. And so we were asked to build a tool which understood everything about what the factors are that impact your COVID risk. So, you're probably aware that your age, your biological sex, your ethnicity, as well as, of course, all of what they call the comorbidities. So, whether or not you have existing health conditions, including things like asthma and hypertension and diabetes, as well as the more serious things. We built a model actually in just 6 hours. It was 3 2-hour sessions with Dr. Robert Hardman, who was a leading clinician in this space and Director of Quality for the Faculty of Occupational Medicine. So one of the leading experts. We very rapidly sort of sat down with him virtually and built a model. And this went from being an idea to being live in just 8 days, of which 5 days was getting it through a clinical approval process. And then this tool was able to risk assess thousands of staff an hour, to be able to make decisions about their risk without them having to talk to their line managers about their personal health information, which is something, again, that I could use this reference in peacetime. In peacetime, they wouldn't normally do. They'd be speaking to an occupational health specialist, but of course there weren't enough of those. So it would create a redacted report for the manager that tells the manager how to go on and mitigate that individual person's risks. It would create a medical report for occupational health to go on a medical file, and it would do this, at light speed, without having to take away the precious time that was being spent, that these clinicians needed to spend doing other things. And that was transformational. And again, this is in Rainbird terms, is a trivially small project to build, but that had disproportionately high impact.
Yeah, fantastic. So from your experience of working with the NHS, what are you seeing as the key data challenges in local health in general, and how can technology such as AI, automation, machine learning, etc., how can that help tackle those challenges?
Yeah, no, that's a good question, because I think a lot of people, when they think about how can AI help the NHS, their mind turns directly to data, and then you do immediately hit the challenges around data privacy and data sharing, and all of the ethical as well as legal implications that there are around that. And I think it's fair to say that generally, NHS trusts are incredibly careful about the data that they hold. principle is you don't hold data that you don't need to hold for longer than you need to hold it. I
Yeah.
think that has shifted a bit with COVID. We are beginning to see, machine learned algorithms based in some cases on large amounts of data that are being accumulated. So if you take something, for example, like ventilator data, to being able to build statistical models that can help make predictive decisions, bearing in mind, of course, that again, machine learning is making predictions, it's not making decisions.
Hmm.
But actually, where we come at this is a slightly different angle, because what you can do very easily is take what a smart person knows and you can start with their knowledge, so a corpus of human expertise on a subject, and build a model very rapidly that's able to scale what they know. I mean, thinking back to previous work that we've done in healthcare many years ago, you imagine taking, one of the leading authorities on something like Ebola, and being able to create a tool that anybody in the
Yeah.
world could use in the face of an outbreak to get contextual advice. You can see there's a force multiplier around human expertise. But actually, I think the holy grail is where these things to come together. So we're working with one organisation that's building deep learn models, so machine learning models based on data around COVID pathways specifically. But actually, what we're doing is bringing the human expertise to that can work alongside the machine learning to predict, when is this person likely to need to go to ITU? When they get there, what kind of interventions and treatments are they going to have?
Mm.
But I think what we're seeing within the NHS and in healthcare generally is there is still a reluctance, I think, if I'm honest, to apply technology to the decision making, to clinical decision making. But what there is there's a huge opportunity and a willingness to apply these technologies to what we might call the kind of middle office tasks that exist within healthcare. So, for example, prioritizing the very, very large waiting lists that are now expanding. That is a task that we can very, very quickly help prioritize and look to see whether or not harm is going to be caused to people who are having to wait because they're in that massive backlog that's now occurred as a result of COVID. And the risk
I
assessment tool
guess
we did.
the I guess with the auditability of what Rainbow's doing, you're able to explain those decisions that have been made. So if these things tend to explode in the press, now and again, you want to be able to explain why somebody has been bumped up that waiting list. Why that decision was made and why it prioritized one person over another.
Yeah, Chris, it's absolutely critical. We don't trust technology we don't understand, and we shouldn't.
Hmm.
Right? There's history is littered with disasters around people relying on technology that's failed them. Now, the reality is that clinical errors and mistakes within healthcare are endemic. I mean, the to err is human, and it's in the nature of it. In fact,
Hmm.
15% of the entire NHS budget is spent dealing with the implications of clinical errors. There
Yeah.
is no doubt that there is a huge role for technology like ours to play in providing, I think it's decision support. It's not replacing what doctors are doing. It is providing them decision support to help, tired, busy doctors with some of the probabilistic reasoning that underpins ultimately what has to be a human judgment. It's interesting. There's a much more enthusiasm for this in the US than there is here, although actually it's easier to use data here than it is in the US. But
Hmm.
but I think some of the work that's been done by IBM Watson and others has created a familiarity with this idea of building AI algorithms that can provide decision support. There are some commentators that think it won't be many more years before a doctor will be found to be negligent if they haven't consulted with an AI in making a decision around things like cancer pathways, cancer treatments. Here, I think we're just a little bit more reticent, but there's huge opportunity to support the operational processes. And I think this is an education challenge. And I think through solving some of those problems, like this risk assessment program, or the work we're doing around waiting lists, this is the way by which trust starts to get built in a technology that has to be entirely auditable if we're going to trust it.
And again, it's not replacing those humans. It's just making them more efficient and more accurate with what they're doing.
Absolutely. I think, there was, if you go back 5, 6, 7 years, there was huge concern about what AI and automation was going to do to global workforces. And of course, there are going to be some shifts as, some of the labor intensive work is moved out of certain sectors. The automation of automotive is a good example of that, where I think there will be some changes, but that was always the case. The automation phenomenon, if we forget about AI, we just think about automation in its general terms. We've
Hmm.
been trying to automate heavy lifting for millennia. ever since the Egyptians made the 5 simple machines that enabled them to build the pyramids, right? We've always trying to take the heavy lifting away. That's not going to stop. But interestingly, this human in the loop, the idea of the technology and humans working together with another very important point, which is the democratization of these tools. These are not tools that are being built by somebody in IT and imposed on the business. Our technology is being used by the business to support itself. There's this whole citizen developer phenomenon where these tools are not designed for software engineers. We build tools, whether you want to build machine learning or you want to build a human-centric model or you want to orchestrate it all together. These are all drag and drop visual tools that you can learn to use in just a few days. So the force multiplier in this whole space is you take these technologies, these tremendously generic horizontal capabilities, you give them to imaginative, bright, sparky business people, and they can transform the work that they do.
Yeah, you want those tools in the hands closest to the people who have the knowledge on those processes or the knowledge of what makes those decisions, not just the software engineers.
That's absolutely key. And that's what we call the knowledge engineering gap. Because if you imagine you take an expert in any particular field, let's say a clinician, and you put them with a software engineer who is interested in software, but not necessarily interested in medicine, the clinician is interested in their space, but not necessarily in software engineering, they're probably very different types of people. You put them together in a room, and a huge amount is lost in translation. You have to put the domain expert at the center of the process of
Mm.
creating tools like this, and that's key.
Yeah, absolutely. Well, listen, James, I could sit and talk to you about this all day, but I know you're a very busy person. So thank you very much. That's been really interesting. And yeah, good luck with Rainbird.
Thank you, Chris. Thanks for having me on.
Thanks very much.